My background is in addiction medicine and in family practice. Currently, I am board certified in addiction medicine and have very close to 20 years of experience working with all types of addictions. Harmony Foundation has developed a treatment program for addictions over many decades, and obviously I as medical director focus on some of the medical issues. Addiction is a field now that is recognized in medicine as a disease. It is a unique disease. It is understood more and more every year, but obviously still is a difficult concept for people to understand. We feel that people have a certain structure to their brain that causes a patient or a person to react differently to different drugs and lead them into a pattern, maybe a fairly unusual pattern of usage that usually ends up completely destroying their life. And the so-called average person may use the drug, certainly have some sort of side effects, maybe some interference with normal activity, but does not lead into a long-term pattern of really what you'd call the illness of addiction. At Harmony, we are involved from the medical standpoint, partly with detoxification from various drugs. Some drugs require very little medical detoxification, we call it, and mainly supportive help. But the two most common drugs we treat, alcohol and narcotics, do require treatment. For alcohol, we use multiple medications to try to assist the person with the first few days while they're involved here at the program. And I can say that most of the time people are able to function and participate in the program in spite of the fact that they are withdrawing from alcohol. Each case, of course, is individualized. Some people require more extensive treatment. The second detoxification process we have here from narcotics involves a newer medication called Suboxone or Subutex, which is a narcotic itself, but works in a unique way, which allows people to fairly smoothly come off of the other narcotics that they were using. Compared to other methods of detoxification that were used until very recently, this is a huge improvement, which makes it much more feasible for most people to enter into treatment. Another part of the medical treatment falls into the psychological area, where working along with our clinical psychologist, we are involved with using psychiatric medications to treat the many other diagnoses that people bring to treatment. Because certainly many people with an addiction problem have a significant psychological problem, and fortunately in recent years there is a wonderful improvement in psychiatric medications that can assist many diagnoses.